Hello, everyone. I am glad you're back here to see me again today for another episode of 2-Minute Emergency. I am Dr. Leslie Sharp, your host, board certified emergency physician, best-selling author, international speaker, and I am here to tell you about another emergency and some symptoms that you may have had in the past. The idea is to do what I can to educate you, to keep you out of the emergency department, safe and healthy. So today's topic is dizziness. Another name for dizziness is vertigo. Vertigo is that feeling that you may have had in the past where all of a sudden you feel like you're swimming, like you're walking around staggering, almost as if you're drunk, or it's so bad that you go to even raise your head and you can't get oriented. You feel like you're going to fall. Vertigo is caused by several things. The most common is within our ear, we have little canals, and these canals contain little tiny crystals or stones that we call otoliths. Think of that if you go back to your days in mathematics, geometry, they're on the X, Y, and Z axis, and they help us to keep upright. So if for some reason those crystals get stuck in any one position, your inner ear can't function properly and you feel dizzy. Most often people notice this when they first wake up in the morning and they go to get out of bed. Basically you sit up and all of a sudden you feel like you're going to fall instantly. I've had this happen to myself. Fortunately, this is generally very benign. And one of the easiest solutions to that, yes, you're going to hear me say it again, is good old water. I talk about water all the time, but dehydration can cause those little crystals in your ear canals to become stuck. Now, that can happen anytime, not just when you wake up, but many people come into the emergency department because they are just feeling dizzy, it came out of nowhere, and they're having a lot of problems just functioning with their daily activities. A couple things that can solve this kind of vertigo is only done by a trained professional, but manipulation of the head. Sometimes there are manipulations that we do that can take that vertigo away right away. There are other things that we do as well. There's medications that can be used specifically for that type of vertigo. Now, there's other types of vertigo. Another one is when you have fluid buildup in the inner ear. Causes an increase of pressure, that puts pressure on the nerves, and that can make you miserable as well. That can last a little bit longer. One of the quick remedies for that, well, I wouldn't say necessarily quick, but one of the medications that we use are called diuretics or water pills, and that can reduce some of that extra fluid in your ear. The third type of dizziness is when you have inflammation within your inner ear. So this may be to an infection, most often viral, but it can be bacterial, and that requires antibiotics or other treatments. Sometimes if the infection is severe, it's something so bad, you may even require surgery. But that's one of those things that you would definitely need to either come into the emergency department, or if you've had this problem before, you may want to see an ear, nose, and throat specialist, otherwise known as an ENT, or otolaryngologist, as we like to say. So those are the three main types or most common types of problems with the ear that are causing vertigo. There are problems outside of the ear which can also cause vertigo or dizziness. The one thing that we worry, or several things we worry about, but one of those things is, could it be a stroke? Now, I talked last week about strokes, and that symptom of sudden onset dizziness can be related to a stroke, specifically if you have bleeding into the back portion of your brain causing the problem. So our sense of perception as far as movement and equilibrium is actually in the back of our brain, an area called the cerebellum. So if you have bleeding in that area, that can cause the dizziness. Another part related that could cause that dizziness is if you don't have enough blood flow to that posterior part of the brain. That's when the blood vessels specifically that are going up the back of the neck into the brain stem have a clog for some reason. And that's the other type of stroke that I mentioned. So you can have bleeding in the brain and an area of the brain that doesn't get enough blood. So those are important things to remember. Other things that can cause it, believe it or not, medications. Some medications that we use every day that can lead to dizziness. So what are the other symptoms that you have along with this? Beside that feeling like you're unsteady, like you're going to fall, many times it's associated with nausea and vomiting. That makes sense. Just like if someone was drunk, they're staggering, they get nauseous, they vomit. Pretty simple. Other things that can be associated with it, you can have ringing in your ears. Fancy name for that is tinnitus. That can happen very easily. And you can also see, if you look closely at someone's eyes, their eye movement, they can't look straight at you. You'll see a twitching of the eyes. Sometimes that goes from side to side, and believe it or not, sometimes it's rotary. And we call that nystagmus. So these are some of the basic things to look for when you have dizziness. Now, if it's something that's prolonged, you definitely want to seek medical attention. Now, all of these are more common as we get older. I did mention I've had this once before myself, so I won't mention the older thing too much. But if it's ongoing, there's treatment. Some patients are on long-term treatment, and some patients, it's just a one-time thing. So in recap, 3 main types or most common types of vertigo, which is to have the crystals in your ear become stuck for whatever reason. The second is inflammation in your ear. And the third is having water in your ear. So all of those can cause vertigo, something we can treat most of the time. Sometimes it can be severe to the point where you may need surgery or other interventions. But if you have these symptoms, they're lasting for a while, you definitely need to come into the emergency department to be evaluated. So I thank you once again for tuning in. Once again, I am Dr. Leslie Sharp, your board-certified emergency physician, best-selling author, international speaker, and I am here to help educate you about how to keep healthy and staying out of the emergency department, and how to continue on with a healthy lifestyle. So don't forget my #1 motto, drink water. For more information, you can always find me at www.drlesliesharp.com. And if you go to that site, you will see a contact us area. So if you have any questions that you would like to bring, or anything that you would like me to mention in one of my future episodes, I would love to hear from you. Thank you so much. Have a wonderful, safe, and healthy day. And if I don't get to see you before then, although I will be back on Thursday, have a very happy Thanksgiving. Take care.